All right, today we're going to talk about some new studies that have made the news around ultramarathoning and colon cancer risk. So let's dive into it because colon cancer risk is definitely something, if you've got IBD, you're thinking about and wanting to reduce the risk of. And we happen to have quite a bit of patients that are also athletes. And so, yeah, I think it's certainly pertinent to a lot of the people that we work with and a lot of people we interact with online as well. So we thought, who better to talk to about this topic than Krista, who is our IBD focused dietitian and also a sports dietitian who's getting her PhD currently in this area. So talk a little bit about this specific area you're wanting to kind of dive further into.
Yeah, my PhD is in kinesiology with a focus in exercise science. And then obviously I'm a dietitian. So these two worlds naturally collide. And then working primarily in GI, I love this conversation. And so this is just an early project in the whole broader scheme of the program, but it's really intriguing. And Dr. Cannon, I think he's at ANOVA. Is that what we decided, that he's somehow related to ANOVA, and that's where this study has kind of been published through, or its early findings. And whenever this started circulating in some of my sports nutrition circles, my ears perked up because I thought, oh, that's interesting. We've never had this kind of data on, and it's particularly talking about like ultra endurance and really extreme endurance activities. So think marathon, ultra marathon, and what Dr. Cannon was realizing in his clinic. So he is an oncologist, I'm pretty sure. Is that right? I think he's an oncologist, and he works in colorectal cancer. And he was noticing that there was more and more, and obviously we know there's more and more diagnoses of colorectal cancer younger and younger. That's becoming more prevalent. And so and he was noticing this, and then he had several overlapping, like, these guys are like really active. They're training for marathons and ultra marathons. Is there a connection here? And so he started exploring that, and that's where a lot of his research, like that's the question he's asking. And so it's again preliminary findings, and he presented at ACSO in 2025, so earlier this year. And we don't have definitive data, but it is an interesting thought that maybe repeated bouts of really extreme endurance activity could be potentially contributing to these earlier onset colorectal cancer diagnoses. So it's interesting.
Yeah, and they recently changed the colonoscopy age too. From used to be 50, now it's 45 because we are seeing that much younger. And I remember when you and I first started talking too, you had this interest very early on, like back in, when was it, 2019, 2020? I don't remember when we first talked. You had that interest in understanding. You're actually the first person that I think we might have done an Instagram live on the topic of like where we might see GI bleeding in ultra endurance sports. We talked a little about that, about how the GI cells slough off a little bit with like the pounding. But yeah, I thought it's very interesting that you and I had that conversation, and now, 5-6 years later, we're unpacking even more about what could be going on in those longer distance sports.
Yeah, it's really, really fascinating. And considering that, historically, all of our physical activity guidelines and recommendations, even just generally, but also directly related to colorectal cancer, has been kind of like the more activity you can do, the more preventative it will be. And there's a lot of, other evidence to go along with that. But I think what we're seeing now is there is definitely a bidirectional curve, like a U-shaped curve. Yes, preventative to a point, but then at some point it's going to kind of flip over into being more harmful than it is good.
And I feel like we've also talked maybe on YouTube about even the role of hydration in that. Now, tell me if I'm wrong on that it can actually, that hydration and your fueling plan, like if that's off, it actually increases the likelihood of those things.
Absolutely. Yeah. We have a lot of mechanistic data and kind of understanding the etiology and the pathophysiology of exercise related gut symptoms. And we know that there's a huge prevalence rate. The longer the distance and the more intense that the activity is, the higher the prevalence rates of like GI symptoms are going to be. Some of them they can range from really benign, like flatulence, all the way to much more, extreme, to like bowel bleeding and diarrhea, and like more urgency and explosive types of bowel movements and things like that. And all of that is related to the bowel ischemia and the lack of blood flow, the lack of oxygen that happens. All of that blood flow is going to be redirected to the muscle, the heart, the lungs, related to the activity. And so the more that you have that, the more the longer duration and things like that, the symptoms are going to be higher and more significant. And then we also know that like heat and humidity play a massive role and are going to make those symptoms typically worse. And so hydration does play a huge role in that. So if we're not properly hydrating, if we're not making sure that like the bowels can cool down in a sense, can kind of like help manage that stress related to heat production through hydration, then those are all going to be exacerbated. All those symptoms are going to be exacerbated. And I think, again, like my point here is we have a lot of mechanistic type of data. We don't have definitive data saying that because there's lack of blood flow, lack of oxygen, there's lots of stress related to temperatures and things like that, that those things are directly related to, colorectal cancer and long-term damage to the gut. But I think you can kind of understand how that would be plausible over time. If you're consistently, there's repeated bouts of that happening and your fueling plan is not on point, I think there's definite opportunity for the gut to be damaged long term.
So that in itself is kind of a scary thought.
Yeah.
And for anyone who wants to read the study too, I don't know if you will have access. I don't know if it's under a paid what is it called? Wall or whatever it is.
Yeah.
But it is called Risk of Precancerous Advanced Adenomas of the Colon in Long Distance Runners. And I guess, Krista, for anyone who may be a long distance runner or someone who is super, 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 super active and may be thinking now watching this, being like, oh, I guess I should look at my hydration. And yeah, what is my fueling like? Am I fueling enough? What would be some of the things you would tell them? Like top like 3 things.
Yeah, really good question. And you're right. Like those are massive priorities. Because again, we don't want to exacerbate what is already physiologically going to happen. Like we know that this is going to happen. So, globally, I would just be making sure that we're staying hydrated regularly throughout the day. So at least having our, half of our body weight in ounces per day, like over the course of the day. And then usually, honestly, for every like hour or so of activity, I like to add another liter. And then if we're also in like heat and humidity, probably think about electrolytes to some degree. And some people like to preload those before their activity. Maybe you have a little bit during, or, play around with timing, but I would think about electrolytes in that case as well. And that will help with the whole hydration picture. You could also even just be mindful of like how much body weight you're losing, at the end of a session. And if that is really high, then okay, we're gonna have to be really aggressive with our hydration plan. That's a little bit more fine-tuned, but that might be something to think about. And then we have resources, or like find someone who, or other resources to help with like carbohydrate intake and making sure that that's on point. So usually that's going to fall between like 30 and 60 grams per hour of activity, and then making sure that you've got another 30-ish or so coming in prior to, and then another 30 to 60 after, and just making sure that we're kind of bookending that activity with carbohydrates. And then if we're doing more than an hour of activity, I like to put some during as well. That takes a lot of like effort and fine tuning and figuring out what works for you. And if there is a disease process like inflammatory bowel disease, we have to be kind of creative and figure out how to make that work. But it's something that if you're listening and that's not something that you're doing, you can start to slowly work your way up to some of those recommendations, and at least bookend the activity with carbohydrates, before and after. And that will be really, really helpful. Let's see. What else did I miss? Do you guys have any other thoughts? Those are the 2 that I'm coming up with off the top of my head.
Those are really good ideas. I guess what's coming to mind for me is with IBD athletes is nutrients, because certainly that could play a role too, like with especially iron, and
Yeah.
when you're working out, changes to iron absorption and all that happening.
Yeah.
So that, and then protein is coming up as
Yeah,
things
for
people
sure.
want to know about. Yeah.
For sure. And I'm sure a lot of people are like, I already have, you mentioned, prevalence rates being really high, and I already have a lot of gut symptoms. The longer I run or the longer that my activity is, how in the world would I be able to put anything in? I'm scared to do that. And that's a question that a lot of people have. And honestly, the best way to do that is kind of like train your gut to be able to take in the nutrition. And so that starts outside of your training sessions, and then we slowly work them into them. But the more that we're able to tolerate the carbohydrates and the fluid at appropriate amounts, the better off our gut's going to be, and the more resilient our gut is going to become. But that takes time and consistency.
Another thing, Ashley, too, when you mentioned nutrients, I also thought of from an athlete perspective and IBD perspective and colon cancer perspective, the vitamin D link in that as well.
Yeah.
And assessing for that, because honestly,
Yep.
it seems here in Canada that it doesn't frequently get assessed. Maybe more so with IBD patients, but the regular population, it's based on conversations with people. This is not coming from evidence that I've read in papers or anything, but it sounds like a lot of people just say like, oh, it's low because you're in Canada, so just supplement anyway. And it's like, well, it'd be good to see where we're actually at for not only vitamin D, but any nutrient of concern, right? So
Yeah, it's sort of
great.
backwards. It's like, yeah, just because it's common doesn't make it good.
Yes. Right. Oh,
I think people say that with IBD too, like, oh yeah, you're not eating enough. Yeah, that's common to have weight loss in IBD, but yeah, not good, not what we want. Not, we don't want people to be malnourished. We don't
Right.
want people to be low in vitamin D, because that does increase your risk on so many levels, like with flare up, and you have to think about colon cancer long term.
Yeah.
So yeah, I think maybe because it's just one of those things, maybe when you see it so much, you almost want to write it off. But I think it's so important that we don't, and that we treat it. Yeah, I've definitely been told the same thing. I think one time my vitamin D was low, and I asked to do it again, and they were like, oh no, insurance wouldn't cover that because, it was not low enough to run again. But I'm like, it doesn't matter to me. Like, I want to check it, because that's going to be a big risk factor, and an important one to stay on top of it. And I think when you add on the layer of also being an athlete, then
Yeah.
you have additional potential losses that you want to keep track of.
Yeah. And I think we talk about this all the time. Like, there's vitamin D receptors all over the body. And, even like our recommended dietary allowances for vitamin D is only based on bone, and the requirements for bone. But we have so much more evidence related to inflammatory bowel disease or athletic populations, and like they're playing a role in muscle contraction, all these different things. And there might be more that we can do, and we do need to assess to be able to determine that.
Yeah. Explain what you mean by that. So you're saying we assess it only in bone?
Well, like how much we say that everyone needs to have coming in, either through the diet or, synthesized, from the sun. It's based on the assumption that everyone is getting minimal sunlight,
Mm-hmm.
and how much we need in order for like appropriate bone.
Bone
What's
health.
the word? Health. Yeah.
So we're talking baseline.
Yeah. So honestly, it's really low.
Mm.
And then, we layer on an IBD or, like an endurance runner or something. Maybe we need a little bit more.
Yeah, and you have to think too, like our recommended daily allowances, for example, are for healthy people.
Right.
That is another factor. And I've definitely read a lot of more IBD papers recently pointing towards even just like a maintenance dose of, vitamin D being a little higher than I think we previously thought it should be. Like not a lot higher, but like,
A little bit.
5,000 a lot of times is more of the minimum. minimum for maintenance in IBD versus, I think previously it was probably more like 1 to 2 is kind of the, and if any being recommended. But of course you don't want to overdo vitamin D either.
Right.
It's not one of those things where you want to overdo it just in case, because that will give you some other issues. But I definitely think it's an important one that doesn't get the attention it deserves.
Yeah, I totally agree. I think you could argue that from the general population too.
Yeah.
Yeah.
Yeah, it's funny because I think about places that get a lot of sun, like desert. My family lives in New Mexico, and I have friends out in Arizona where they get lots of sun, but they'll see vitamin D be low quite often. And a lot of that has to do with, in these sunny, hot places, people are going to be indoors more. So it's
Yeah.
like, it's the other hemisphere effect of, like, typically northern hemispheres are where you're going to see the lowest vitamin D. But then, in your southern, we're going to be indoors because it's just so hot. You're not going out in the 110 Fahrenheit very often.
We even will see that in like sports that are predominantly played indoors. Those athletes like basketball, those types of athletes tend to be lower in vitamin D too. Yeah, it's interesting.
Yeah, that I hadn't thought about that, because when you're training, especially at a higher level, you're gonna be doing a lot of stuff indoors.
Yeah,
You might not see the day.
primarily,
Yeah,
right. Yeah.
great
I
point.
think another caveat that I meant to mention when we were talking about, fueling and hydration kind of mitigating some of the GI effects. What I found interesting in some of the literature that I was looking at was that even when those things are really on point, they do help manage, like, and can certainly bring down symptoms, but it seems like they don't always do so like fully, and there still is some like microbiome changes, and you still have physiologically, like, you still have lack of blood flow, lack of oxygen to the intestines, like that is happening, and then once that reperfusion happens, that blood flow comes back, it's redistributed. That's often when we see like some of the inflammatory damage happening. And so, yes, it's gonna. What I'm trying to say is like it's gonna help to a degree, but it's not going to mitigate everything, and we can still see some of that damage happening over time. And so I found that really interesting. I was like, it does make sense and is plausible how just like repeated extreme endurance events can like wreak havoc within the gut.
What do you think, what do you think is the scenario that's creating the increased risk for people, or creating that the effect, that the negative impact when you go too high of a level?
Yeah. I mean, I think it all goes back to those mechanisms with the bowel ischemia and the hypoperfusion, lack of oxygen, lack of blood flow, because it has to happen. Like, digestion is not a priority. We have to get blood and oxygen to the working muscle, to the heart, to the lungs. And that is the priority. And then you're doing that for long periods of time, and intensity is kind of up and down. That seems to me to be the biggest driver. And then what I found interesting too, like I mentioned before, is that reperfusion is really where a lot of the oxidative damage seems to happen. And so it could lead to tissue that changes to the DNA in that tissue repair process.
What is
So,
the reperfusion?
like when the blood flow is redistributed back to the gut after,
Mm-hmm.
and since he calms down, the running or the exercise stops, you can begin the recovery process. So, I mean, I'm speculating, and like I'm using the literature to kind of speculate an answer, but I'm saying that it's plausible that there could be contribution to adenoma formation, when adenomas are not necessarily always cancerous, but they are precancerous. They have the ability to become cancer. And so, and that's what the Canon study is linking to, that like 40% of 100 marathon and ultramarathon runners 40% of them had at least one adenoma, and 15% of those had advanced adenomas, which are considered precancerous lesions. And the expected percentage in that, this was the average age participant was 42 and a half. So 2.5 years before that 45 cutoff, which is backed up from 50. The expected age range with adenomas in that demographic is only 1 to 2%. And we saw 40% with 15 of them being advanced. So I think it's plausible that, that whole, the lack of oxygen, lack of blood flow, microbiome changes. We know that athlete guts are different than your average person's gut microbiome. And not always necessarily bad, but we see changes in butyrate following marathon and ultra marathons. It goes down, and we know that plays a really big role in the gut barrier. And so that, and then, with the tissue repair process potentially being intercepted or not fully, happening as it should, I think that kind of creates a perfect storm to where we can see adenoma formation and then potentially could lead to a colorectal cancer diagnosis.
Yeah, and then I guess what was not really studied yet is if you had someone that had better recovery plan, a better recovery plan in place, or a better fueling plan in place, like how would that have changed trajectory? Because even at very high levels, I'm sure you've seen this too, we certainly see that even professionals struggle to get enough to properly recover, to a lot of times it might be on the radar, but it has to be dialed in so much that it requires outside help often to really get it to the place that we want it to be, the place where we see optimal recovery.
Yeah. And it's, I think there's probably a really big part of this is the repetition, the repeated bouts of extreme endurance. And then you're right, recovery is probably playing a really big role in this, because the participants in this study, they had completed multiple marathons or ultras between October and December of 2024. So that's only 2 months, and they're doing multiple. So that to me sounds like 3 or more. That's repeated. That doesn't give a lot of recovery time. So I think you're right that is playing a really big role in the whole process. So I'm, not even saying that we're not necessarily saying never do ultras or endurance, types of activity, but probably the repeated bouts is not super great. And if we're thinking about inflammatory bowel disease, that type of population, I would not suggest repeated bouts of ultramarathons in a short period of time.
Yeah, definitely. And if you are doing any level of that, it seems like having somebody who understands both worlds is really key to navigating it and making sure that you're reducing your risk overall.
Yeah, for sure.
Yeah. Well, this has been a really good conversation and really helpful for you to kind of break down some of the thoughts behind everything that's going on in the news. I know the news is always hyped up and we kind of miss some of those core elements and so it's nice to be able to take a moment and kind of look at that a little closer.
Yeah, I agree.
All right. Well, if you are someone who is an athlete and also has IBD and you're navigating both worlds, reach out. Krista's still taking patients if you'd like to work with her. And don't forget to subscribe to our content so you don't miss any of our YouTubes, and we'll see you next time. Take care.